The healthcare system is one of many social institutions that provides medical services which work to prevent, diagnose, and treat assorted health problems. But I'm not here to just tell you what healthcare is. I'm here to tell you about how it's impacting people's lives and interacting with other institutions along the way. Like almost everything else in life, the institution of healthcare is viewed very differently by a million different people. Although nationwide our appreciation towards medication has decreased, our faith in science and progression are still strong. The achieved status of a doctor is what drives us to believe what they say so often. And though sometimes they may be wrong, like any other person, the healthcare system is doing things every day to rescue and heal people. Although there is no population data to prove just how many people are saved or benefit from healthcare, it has been very visibly seen that mortality rates today are the lowest they've ever been. The perceived greatness of healthcare does vary according to important social factors, such as location and culture. In today's society, there are over 1 billion people who do not have access to effective and affordable healthcare. The poor developing countries of the world retain over 93% of the world's disease, but only have the benefit of 11% of the world's health spending. Many parts of the world are not affluent enough to provide such education to their people. The lack of funds for these countries can most likely be tied to social inequalities that deem them less important than predominantly white areas. The 4 different sociological approaches examine health and healthcare very differently. The functionalist approach requires that society functions as a stable system, so health and how a person can contribute to society when they are well are extremely important things. Illness is viewed as a deviant behavior that must be controlled and cured in order for society to function. Thus, the functionalist perspective values healthcare and deems it extremely necessary. The functionalist also believes in the hierarchical setup of a physician-patient relationship, in that whatever instruction the specialist gives, the patient must follow. The conflict theorist sees that individual health in the healthcare system are influenced directly by social inequalities pertaining to class, race, and gender. Conflict theory also believes that physicians, due to the level of power they hold, have skewed and manipulated the system by diagnosing social problems as medical problems for the benefit of their own income. Symbolic interactionism is entirely about health and illness being social constructions. These theorists believe that physical and mental illnesses do not exist in their own reality, but only in our society because of the norms we have established. Similar to conflict theory, symbolic interactionism believes that physicians control and diagnose problems only for the mere purpose of displaying their medical knowledge and authority. Lastly, the postmodern theory believes that doctors and medical establishments have gained control over illness and patients through the power they hold because of their so-called clinical gaze or perceived expertise. A different social institution that healthcare impacts in huge ways is the economy. The medical industry alone accounts for 1/6 of the entire economic system. Spending on healthcare today totals to about $2.5 trillion, and it's only increasing. Health insurance is only going up, and the cost of receiving healthcare is doing the same. The issue with this unnecessary spending has a lot to do with the lack of education people have on the topic of healthcare, thus the lack of time they take looking for a health provider. Consumers do not hold the power when it comes to the health market, and many Americans don't know which doctor or drug or treatment is best for them, let alone the most affordable. Browsing for prices and being uninformed on the full cost of care, even when insured, causes a great deal of unnecessary spending. The surplus of spending for the healthcare system might be the only negative development it has made. Healthcare has evolved significantly between the early 1900s and today. The average life expectancy in 1900 was 47 years old, and today it stands at approximately 78. We're living longer because health technology has constantly been progressing and discovering new ways to cure, treat, and better sustain human life. During the early 1900s, there was a complete lack of patient respect within the physician-patient relationship. In some cases, admitted women would not be informed of their diagnosis, but instead their husbands would be. Some patients were subject to experimentation and testing without consent. The popularity of smoking everywhere, including in hospitals, posed a severe health risk that was not revealed until the 1960s. Patient segregation and discrimination based on religion, race, and gender was also very common in the early 20th century. Also, almost every physician up until the civil rights movement was a white, middle-class, straight man. The majority of those issues do not affect medical care today. Patients are now treated with the utmost respect, most of the time, and since it is encouraged to keep people out of the hospital because of the Affordable Care Act, many community health initiatives are active. Healthcare discrimination, however, is still present today, just in a different form. Members of the LGBT community can be, and often are, turned away from treatment because of their sexuality or gender identity. 22 out of the 50 United States have healthcare anti-discrimination laws established based on sexual orientation, and 14 of those based on gender identity. Although there have been many advancements in the healthcare system from 1900 to present day, inclusion remains a factor that could still use progress.